So here we go. Hey everyone, I'm Dr. Jason West. Welcome to our live cast. Man, it has been a struggle today. And the reason why we're having a difficult time is we were going out and we were working with our channel, getting it all set up. We were sending little, test things to making sure our lighting was right and our sound was right. And anyway, we got tagged over to Facebook as not knowing what we were doing, and what happened is they shut off our channel. So I'm hoping that our people from Facebook can come on over here because this is working really well on YouTube. So that being said, some exciting things we're going to talk about. Number one, we have a supplement giveaway. I'm really excited for everybody to participate in this, and there was two things that were really important for you to participate in our supplement giveaway. The first thing is I needed you to ask a question, so we've had at least 6 questions coming up. The first thing was on COVID toe. We're going to talk about that in a minute and why so many viral conditions go to the skin. The other thing we're talking about is Bob asked me to talk about vitamin A, talked about home testing units. We have some updates on the ozone units and parasites. So that being said, we have a lot to go over on this. I'm excited to be able to share with what's been happening in the office, with some of the neat things that are occurring, and then just getting everything put together to do supplements. So the thing that we're giving away is this right here. It's called liposomal vitamin C. What this is it's vitamin C that they make. It's a powder that they mix with the fat. And so you get the benefits of having a fat, and you also get the benefits of the vitamin C, that when the fat mixes with the vitamin C powder, what it does is it causes a mycelial formation, which means that the vitamin C is right on the inside of this. It gets in the GI system, it gets absorbed, and it's almost as good as having an IV vitamin C. It's one of my favorite things to take. This is liposomal vitamin C, and here's what's happening on our supplement giveaway. One, ask a question. The other part of it is this. The person that gets the closest to how many photocopies that my dad gave out over his lifetime, we are going to give this prize giveaway. And what that means is my dad was just always giving people studies. He literally wrote a book report every night. He put it on the chair in my office that talked about liver function, kidney function, muscle function, arthritis, how to be smarter, how to have better brain function, how to balance hormones and stuff like that. And it was just a really neat thing that he was putting together. And so he actually would give everybody a study when they came into the office. Over the course of 50 years, he actually came up with the amount of studies that he handed out. And so if you know what the study is, I'm going to give you a free bottle of liposomal vitamin C. Ask a question, tell me how many copies they give out. It's higher than 10,000 and it's less than 10 million. So, all right, I got a little note from my friend Julie Patterson. Hi, Julie, one of my pals down in Lava. Could you talk about home water filter systems and what you think is the best for well water? So yes, Julie, we'll totally go over that. I'm going to add that to my list. I'm also going to talk, here is my agenda here. Let me just get it pulled up here in the background. So liver health, COVID toe, vitamin A, well water, home testing units, ozone units, and parasites. So we've got a lot of stuff to come over. So let's just start into those questions. Julie, I'm going to go after your question first. Thank you so much for participating. Julie runs a restaurant in a little town by me, Lava Hot Springs, the Wagon Wheel. And so she said, talk about home water filtering systems. So here's my thoughts on water. The better that your water is, the healthier that you're going to be. And one of the things I tell people is a filtering system is really good. I personally like a carbon or charcoal filtering system. I'm not a super big fan of the RO or reverse osmosis water filtering system unless you're supplementing with minerals, because I think our reverse osmosis water takes out all of the minerals and then it's not as healthy. I think well water is really, really healthy for you if you have a good well, preferably more than 30 feet. Is what my patient that is a water specialist is telling me. That's how much filtration that you need. And the water can't be too warm. If you get warm groundwater, it's not as healthy. But Julie, I love well water. I think it's reasonable to get it tested to see if there's any heavy metals in it. And also for home filtering systems. For drinking water, I just like carbon filters. I think they're great. I think they filter a lot of products out of it. And I think that is a really good thing to have. I grew up on a well water. I think it's really, really healthy for you to have. And so home watering filter systems, I like a charcoal filtering system. If you can put it between your house and inside of your house, you are a semi-permeable membrane. What does a semi-permeable membrane mean? It means that whatever comes in contact with your skin, you're going to get inside your system. So it's not only important to have well water or healthy water, filtered water, it's also really good to bathe in. And I'm just not a super fan of reverse osmosis, but I will say this. I'm really open-minded, and if someone brought me some information about reverse osmosis water and showed me something, I could totally change my mind on that. It's just been my experience so far that people that have RO systems, they seem to struggle a little bit. So maybe it's just I'm biased on that, but a good carbon or charcoal filtering system is what I like. Hey, Rebecca Bogus. Hey, Rebecca, all the way out in Michigan. Again, just someone I really enjoy my relationship with. How could you help heal a child that's 10 years old with asthma? So this is what I would do for that, Rebecca. Number one is give them vitamin A. Someone else asked about vitamin A. Vitamin A is a mucous membrane lubricating system. 10 to 20,000 units for a kid is where I would start with my kid. And again, this is not meant to take the place of having a workup with a healthcare provider, but that's where I would start. There's also a treatment called the IRR treatment. I've got a handout and a presentation, a digital presentation on it. Rebecca, if you will hashtag IRR in the notes, then my team can reach out to you and get that information, or you can send me an email at info@West Clinic Online. It's called the infraspinatus respiratory reflex, and what that means is there's a nerve root that comes out of your neck. It goes down by your shoulders, and the back part of the nerve goes to your shoulders, the front part goes to your lungs, and there's a nerve reflex. If you work on that muscle, it resets the lung. The muscle is called the infraspinatus. It was developed by a medical doctor in Louisiana named Harold Philibert. He did a study on 4,000 patients of all ages, kids, adults, and showed literally an 80% resolution rate in asthma using the infraspinatus respiratory reflex. I also see a lot of food allergies and sensitivities to that, particularly food dyes, red and yellow. And then my dad always told me, and my dad was practiced for 51 years, had a huge impact on my practice, and he thought that asthma was a sensitivity to dairy. So be careful with dairy with that, because it helps or makes the body create mucus. And then the mineral called molybdenum. Molybdenum is really good for asthma. And anyway, and then Rebecca, the second part of your question here, especially concerned with COVID-19. Well, we're all concerned with COVID-19. So we go back to the baseline. I've had people calling from all over the United States. Vitamin C, vitamin D, vitamin A, zinc. There's what I go to, some IV vitamin C I think is really good. And there's different clinics and hospitals across the world that are using it. Dr. Richard Chang's got a YouTube channel. He's talking about what they were doing for people in China. And then there's some people doing it in Italy, New York, Minnesota, Houston. And I think IV vitamin C is really good for the COVID virus and for asthma. For a kid, I think I would be right around 10,000, maybe 20,000 milligrams of IV vitamin C. But for and that's if they were having a viral incident. Going back and just doing a real quick circulation on or summary on this, Rebecca, 10-year-old, 10 to 20,000 units of vitamin A, 3,000 milligrams of vitamin C would be where it would be if it was my child. And then also molybdenum, it's a trace mineral that you can get a hold of that is very, very safe. It's very good to get asthma and junk and stuff out of the lungs in my experience. And then you want to make sure good food, good air, good water. Eliminate refined carbohydrates, high fructose corn syrup. And I have 5 kids. I know what I'm asking. As much as possible, you can do that. Now, another question. Lacey Henry. Hey, Lacey. How are you? One of my peeps from California. what are your thoughts about the new corona mouth spray vaccine? And my thoughts on a mouth spray vaccine is I'm for everything that works. I'm a little bit hesitant of any of the vaccines coming out right now, Mark, because there's just not a lot of data on them. I think where people should really be working or investing is trying to keep your immune system as healthy as possible with vitamin A and vitamin D3. I did do a little bit of poking around on the corona mouth spray vaccine. There's a lot of excitement about it. And my hesitation is we just haven't had very much time putting it together. I just want to get a little bit more data about that. And they say it's different from the other vaccines. And so in a minute, Lacey, my promise to you, I'm going to show some people one of the things that we found on a couple of people in the office over the last couple of weeks. I'm going to show a video of that. It's a couple of minutes long. It's kind of fun to show. And then I'm going to do a little bit of research on that mouth spray vaccine and some of the websites that I like. I like Natural News. I like Green Med Info. I like Mercola.com. Those are some of the pages I like. I also really like PubMed and a website called Pogo Frog. Now, I'm not trying to tell anybody you should go to those sites. This is just some of the sites that I like to go to. And so, Lacey, I'm going to come back to that in just a second. Now, one of the other questions that goes along nicely with Rebecca Bogus' question about vitamin A, let me bring that up here. So I just got to switch some things around really quick, and we're going to bring up some vitamin A. So let me get this kicked over here, and I'm going to get over to vitamin A. Here it is right here. Okay. So let me give you guys some information about this. This is just fantastic for so many health conditions. And it's one of those things where they said, Dr. West, what is your favorite types of vitamins? And my response is all of them. B12, folic acid, vitamin A, vitamin C, vitamin D3, probably vitamin C is in first line, but vitamin A, it's good for antioxidants, skin, acne, wounds, GI, epithelial barrier. It's good for immune balances, infections. There was a study that I showed on a live cast that said that vitamin A deficiencies were a big problem with kids that had lower respiratory infections, which is bronchitis, pneumonia. Certainly asthma would be involved in that. And so we just wanted to review this monograph. So I'm just going to jump down here. Here's some of the things it's really good for. It is good for ocular health, night vision, epithelial tissues. This is what I'm excited to share people with. It plays an important role in maintaining the integrity of the epithelial tissue, the mucous membrane secreting cells that line glands and organs of the body. Many studies show that adequate intake of vitamin A is associated with a reduced risk of epithelial cell cancers, mouth, skin, lungs, bladder, breast, stomach, cervix. It's really important for helping maintain healthy epithelial cells and is an effective barrier against infections. Now, this comes out of a monograph. The recommended daily allowance, which I don't really follow. I like to follow what's called an optimal daily allowance, is somewhere between 5 and 35,000 international units a day. I like to be right around 10. I haven't seen a lot of side effects or problems with vitamin A. And certainly, if you're interested in any of the vitamin A studies of this handout and stuff like that, again, info at West Clinic online, or I guess you could just hashtag vitamin A and we'll see if we can get you the study. So that was one of the things that they talked about as far as on the agenda. The other thing that I wanted to share with people is something called COVID toe. So let's go talk about a COVID toe here. I put together a little presentation, and let's just kick this over right now. And it was something that we put together in the clinic. I don't remember exactly what it was. Maybe it was Lacey that asked me or someone else. But anyway, let me get my presentation here. Okay, so right here we go on COVID toe. Now, this is not something that has been accepted as one of the symptoms of COVID-19, but what's happening is more and more people that are having this infection have lesions on their feet, intense itching and burning. And the other thing that doesn't seem to be correlated, at least for the information that I was able to find, was the severity of the COVID toe was not linked to the disease state, which means if you had a really bad problem in your toes, it doesn't necessarily mean that you're going to be in the hospital and that you're going to have, need a ventilator or anything like that. But it's really interesting as far as what it looks like. So here's one example of COVID toe patient that I was able to find on the internet. You can see the lesions. Here's another picture where, and a lot of people are saying, oh my gosh, I have that. And remember this, it's possible that it can be a manifestation of COVID-19, but let me just say this. There's a lot of things that cause skin rashes and problems, and there are a ton of viruses that cause skin problems. Here's another example of the COVID toe. This happened with a patient, I think they were in Michigan, that had this, and I just wanted to remind people here that shingles, cold sores, what they call tinea corpus, warts, hand, foot, mouth disease, all of these are caused by viruses. And if you walked into my office and said, I have COVID toe, or if you came into the office and said, I have Epstein-Barr, or shingles, or canker sores, or cold sores, or West Nile virus, or influenza, the goal of getting you better is to get your body's immune system working. And so what I like from that is we can help people to improve their health. It's just not me saying it. I actually put it together in one of my books here. It's an Amazon bestseller called Hidden Secrets to Curing Your Chronic Disease. It's in chapter 9 and chapter 10. And we talk about it so much about turning on the immune system that we've put together a whole book system on how to get people healthy. And the goal is to put everything back in balance, get your immune system working. And so that book is available, drwest.info. If you've ever been a new patient at the office, I actually give you the book. So then let's go back to our agenda here, which is working on questions. So I got to get back to really quick agenda here. All right. We talked about vitamin A. The other question someone had is, Dr. West, what about the home testing corona units? And so there's a whole bunch of stuff on the market, or at least coming onto the market, and we're talking about is there something that is going to help people to able to know if they have immune system, if they're healthy or not. And I haven't seen anything that is blowing my socks off yet. There is a study out of Rutgers, or at least a Emergency Use Act, a EUA, about a home saliva test that shows you have immunity or antibodies against the coronavirus. I'm really excited to see more data, more information about it. I was also be able to, I think there was a company that came out with a home swab unit that they're cranking out. I can't remember the company name right off the top of my head, but as more and more data comes out, it would be wonderful to know if you've been exposed to COVID-19 and then what is happening with it. And so it would be really nice to be able to have that information. So I'm all for the testing. I'm most excited about the saliva testing. I've only heard about the nasopharyngeal swab where they stick a swab in the back of your throat. It's kind of hard to get accurate data on it, which leads me to the next thing. I'm frustrated with the coronavirus panic. I'm sure everybody else is too. And one of the biggest reasons is it's so hard to get good data because it's presumptive diagnosis and presumptive deaths. We don't know what the real numbers are. And people are like, hey, I just want to know the truth. I'm right there with you. I'd sure like to know if we could get better data and know what's happening with the coronavirus and the coronavirus deaths and infections. And if you've been paying attention to the news, you saw the people that had passed away, I think it was end of January, early February, and now they know that there's coronavirus was a factor in that. So what does that mean? It means there's a lot of people that have been affected. There's tons of people that are mild or asymptomatic. And unfortunately and tragically, there are people that aren't doing so well and have died, but the percentage is really, really low, and I'd love to get more truth and more data. Now, the other thing that we're talking about, someone asked me about the coronavirus and parasites. Now, this is a really interesting connection. I don't think that there is a link. If you have parasites, you have coronavirus, you have parasites, but it's a huge problem. Is parasites, and most traditionally trained Western medicine doctors, at least in my area, are just really tell people, I don't think that there's a parasite problem. And I wanted to show you guys some of the stuff that happens in the office. We've been able to find some parasites doing some medical research, and so I'm excited to cue this up. Let me just pull the layers off. Hey, you guys, check this out. This is some of the stuff that's happening right in the United States, parasites. All right, you guys, so I guess it's this way. Oh man, I can't get my fingers right. All right, so this is one of the things that we do in the office. We do some medical investigation. We do a patient history. We also do some blood chemistry tests, a complete blood embolic panel, complete blood cell count, we get people's history. I see so many people that are traveling and come back, they don't feel very good, and they're diagnosed with a neurodegenerative disorder or muscle disorder or fibromyalgia or some type of autoimmune condition, and they get something like this in their system. So I'll get myself out of the way so that you can see that. But wow, is it just an amazing thing that's happening for people? There's stuff inside the blood. You can see these are red blood cells that you're looking at. And this is a little parasitic organism. My teacher taught me that this is something that they call a protoplast. This is something that he hypothesized, but what it does is it causes a lot of nerve system, nerve condition problems, causes a lot of autoimmune stuff. There's an easy way to assess this. So once the coronavirus has gone through and we start to have some normalcy return, I really like to get with my patients, the Western family that we've been working with. Let's figure out how we can keep blood healthy. If your blood's healthy, you are healthy. And so this is something interesting things that you see inside of the office. And man, is it just something that it's mind-boggling every single time I've seen one of these. I've probably seen, I don't know, 50 or 60 over the last little bit. So I just wanted to give people a heads up that it's not just the coronavirus that's making people sick. It's bacteria, it's autoimmune, it's a lack of balance. And the way to get people back together is to balance everything. Now, I've got a question here from one of my YouTube live friends. This is Cupcake Paper. Hi, Cupcake Paper. I saw you last week doing some really neat things inside of the YouTube. Thank you so much for joining us. So let me just bring this up. So here we go. Cupcake Paper, here is your question here. Dr. Jason West live question. Talk about clotting with COVID and using enzymes. So I think enzymes are an underrated way for people to have good health. And enzymes basically make things work faster. I particularly like some enzymes called serrapeptase. There's also the nattokinase, and there is, man, I'm just having a brain squeeze. Okay, so we got, excuse me, we got some music going on. My fault here. Let me get this set up again. I apologize. That should be all cleared off now. Is the music gone? Okay. Thank you very much. Sorry about that, everyone. We're having a little bit of, again, we haven't quite got everything dialed in on my side. I apologize. Anyway, enzymes. If your blood is not healthy, then you are not healthy. If you have too thin a blood, bad things happen. If you have too thick a blood, bad things happen. One of the things that we see in a fair amount of people is a buildup of fibrinogen in their body. Fibrinogen is these little tiny layers, or I guess clotting factors, liver toxicities and stuff like that prevent red blood cells from going where they're supposed to. Also, when you get the red blood cells injured or the vascular system injured, what happens is the body secretes these little mesh-like things, puts in some platelets, and so that the body can go into the healing process. So if you're having an inflammatory condition, you have excessive, fibrinogen and clotting that's going to occur. It's going to be a risk factor for any type of infectious disease, but in my opinion, particularly with the coronavirus. And if you can help to keep the blood as, ideal as possible and not be really thick and not be too thin, then you're in a good spot. I like some of those natural enzymes. I like nattokinase. I think it's really healthy. I like serrapeptidase. I think it's really, really good. And my favorite one that helps blood cells to be slick, but it's not a blood thinner. It's not necessarily an enzyme, but you can get a lot of value out of that, is vitamin E. I love vitamin E, and by the way, vitamin E has some natural immune system health. It's good for connective tissue, it's good for tissue repair, and it's really good for viral infections. It's one of my favorite things to use for Epstein-Barr. And Epstein-Barr is not exactly like the coronavirus. There's some differences, but a virus is a virus, and there's certainly not a lot of downside of vitamin E as long as you're around 400 units, give or take, in my opinion. Certainly if you are going in for a surgery procedure, dental procedure, or something like that, you want to be careful with vitamin E because it makes the red blood cells slick and you're going to have some bleeding. Now, we have another question. Mommy Strong, treatments for Epstein-Barr, it's EBD. I'm hoping that you mean EBV. Is that what it is? Okay, EBV as in victory.
Oh, did I say D?
Yes. Okay, so I'm really sorry, new Mommy Strong. I have a schizophrenic helper that is having a hard time writing some stuff. So we're going to switch over. Maybe the blue screen will help her to not have not schizophrenia. That's what I meant, dyslexia. Man, I'm just all over the place. Okay, new Mommy Strong, you had a question for me about the treatment of Epstein-Barr virus. So the first thing was, let's talk about this a little bit. I think literally 99% of the population has been exposed to the Epstein-Barr virus, also known as the kissing virus or kissing disease. And it's spread by casual contact, kissing, drinking out of the same glass, eating off the same fork, etc. And it depends on your genetics how it's affected by you. And what I mean by that is some people win the genetic lottery, they get great genes from mom, great genes from dad, and they're literally bulletproof. And one of the perfect examples of this is the comedian George Burns, who said the key to health was 2 martinis and 2 cigars every day, and he lived to be, 103 or 104 or something like that. And then you hear about some poor secretary whose boss, smokes, she gets secondhand lung cancer and has problems at 23, 24, and the difference is the gene structure. Now, with that being said, there is some really neat ways that you can modify or reduce the expression of your genes by healthy choices and healthy lifestyle and stuff like that. And that's what we try to do with people that have the Epstein-Barr virus. Now, for the most part, I think we do a really good job, but I can think of some people right off the top of my head that I have worked as hard as I can, and we just have not been able to get rid of the Epstein-Barr. Now, it happens a lot more that we're able to help people, but there's some people that I know that I'm thinking in my head right now of, man, I just wish that I had a stronger magic wand or some stronger treatments. But for the most part, new mommy, here's what people do for Epstein-Barr. The first thing is get good building blocks in your system, good food, good air, good water, get your body on a schedule, eat healthy and alive food, only eat food that spoils, just eat it before it spoils. That's one of the rules, and what that means is you just want to eat, stuff that's going to go bad. If you put a Twinkie or licorice or a fast food burger out on a windowsill and then nothing eats it, there's a reason why. It's full of insecticides, which we marketingly call food preservatives, but we want to have the food as healthy as possible. And then what you want to do is go after the immune system. Potassium and hydrochloric acid are particularly effective, in my opinion, with Epstein-Barr because it changes the hydrogen ion structure inside of the lymph nodes. It's based upon a study called 3 Years of Hydrochloric Acid Therapy that is one of the best studies I found on the immune system. It is fantastic. The doctor was Henry Pleasance. He went to Africa and helped to get junk out of the lymph nodes of the patients that he was working with. Potassium salts and hydrochloric acid, either orally or IV, was really, really good for that. So that's number one. There's a Native American herb called Lomatium dissectum that is really, really good for Epstein-Barr. The only caution that you have to have with Lomatium is it's so good, it makes the body burn up toxins and everything else that every once in a while you'll get a one-time detox rash. And when I say every once in a while, it's pretty common to have this detox rash. It's actually a pretty healthy healing thing, but it's miserable for 3 or 4 days, 5 days if you have it because you're pushing out junk and toxins out of your system. We already talked a little bit about vitamin E and then getting a lymphatic drainer. I like something called myosotis or Spanish black radish for the lymph nodes. So turn on get the body healthy, water, turn on the immune system, get your body on a schedule. Lomatium's really good, vitamin E is really good, potassium and hydrochloric acid is how I like to work on Epstein-Barr. So there's a lot of information inside the office. It's something that we treat frequently. There's a study in the British Journal of Medical Practitioners that says that Epstein-Barr infections, if they're not taken care of or not stimulating the immune system, cause neurobehavioral, neurodegenerative, psychiatric, autoimmune, and fatiguing illness, which really what that means is the Epstein-Barr goes after the weakest link. The next question, Tammy Thompson, your thoughts on CBD, that is THC. So, Tammy, I'm getting this question asked more and more about CBD oil. And my response is if it helps people, I'm all for it. And I've seen it help a lot of people. I've seen a lot of people that it doesn't seem to make a difference one way or the other. So I'm saying, it's kind of like everything else in healthcare. Excuse me. There are some things that really, really help people, but it doesn't help everybody. And I have no concerns or problems of people trying CPD. I just ask them in the patient workup, hey, keep me informed. And I see some pretty good outcomes with it. I see things for pain. I see pretty good things with emotions. And I'm a fan of CBD oil, of the THC CBD oil. And then also, and I'm kind of worried that my mom might be watching or someone's going to tell her, but for certain cases, I think the CBD for THC and some of the chronic pain patterns for complex regional pain syndrome and reflex sympathetic dystrophy and stuff like that, I think that stuff works better than some of the traditional medical painkillers. Now, it's not something that we dispense in the office. I don't have a license to prescribe it. It's just what I've read and the feedback that I get from patients. But CBD oil to me, THC CBD oil to me feels just like oil of oregano or coconut oil, and I wholeheartedly think that you should try it, and if you're seeing good outcomes, then you should stay with it. All right, so we've covered a couple different questions. We need to come back and talk about, people keep asking about the dosages and what we're doing for people that are asking about the coronavirus, how we're keeping the office clean and safe, and how we're keeping ourselves and the team and everybody associated with the West Clinic. And so I feel like a little bit of a broken record, but I need to tell people there's some really important things that you can do, I think, to reduce the risk factors for the pandemic that's occurring. The first thing is to get your immune system as healthy as possible, which is rest is so underrated, water is so underrated, but then some other things that are really effective is vitamin A, 10 to 35,000 units, 10,000 is a good dosage, 10 to 30,000 units of vitamin D, particularly in my area of the world, Little Idaho. We don't get enough sun, and it's hard for the sun to convert 7-hydrocholesterol in the skin to vitamin D3, and so I think it's really good to supplement. Most people, when you start doing tests, they're around 20 to 30, and ideal is 80 to 90. You reduce the risk factors for autoimmune disorders, you have healthy skin, you have healthy bones, and it protects your respiratory system. So vitamin A, 10,000 units, vitamin D, 10,000 units. I love vitamin C, particularly the liposomal vitamin C. This is one of my favorites, but I like all vitamin C. We have some pill form. Some people don't like the liquid form. Pill form is really good, and also zinc, about 30 milligrams of zinc sulfate. Matter of fact, in my opinion, one of the doctors that was pushing the hydroxychloroquine and the azithromycin program was supplementing also with zinc sulfate, and I think zinc sulfate was one of the things that was really helping people. People ask me about, how do you feel about hydroxychloroquine and azithromycin? My response is, look, I'm for whatever works. Whatever works is going to help people. If that's showing promise, there's been some studies that say, yes, it's working. There's been some information doesn't make a difference. Some doctors in the ER and the COVID front lines are saying, yes, we're seeing outcomes. No, it's hard to kind of tell what's happening. But if I'm on my desk, man, I'm totally trying that. But I'm trying everything else too. Vitamin C infusions, increasing my vitamin A, vitamin D. Okay, Tammy was actually asking about CBD without THC. And I thought I answered it. I'm sorry for the confusion. So let me just clarify that, Tammy. I'm all for CBD without THC. I think that there's a consideration for using CBD with THC for chronic regional pain syndrome, reflex sympathetic dystrophy, cancer, some other things. I think there's a place for that. But your question, I understood it. I'm sorry I didn't answer it right. CBD without THC. I see a lot of mental and emotional conditions like anxiety and stress and depression and stuff like that that respond well to the CBD without THC protocol. I would also consider adding some lipotrophic B vitamins, which are the B vitamins that get the nerve muscle to relax. It's really good for restless leg syndrome, which we talked about last week's live cast. It gets the vessels to basically relax. It's really good. I call it my road rage formula because I've given it to some spouses that have a hard time driving. You know who you are, and patients that are associated with them know who they are. And we have this kind of running joke in the office. Lipotrophic B vitamins are really good for emotions. I'm a big fan of CBD without THC. There it is out on the record. I've seen good clinical experience with that. And also, my friend Cupcake Paper says, CBD, is it liver toxic, question mark? And the answer is maybe. But what I would be doing, if any type of chronic health condition, your liver is the powerhouse or the cleansing house of the cell, or excuse me, of the body, and liver detox is a really good thing. And so if you're any concern about CBD and liver tox, milk thistle and niacin are kind of my go-to things. I think niacin is fantastic. We did a post about 3 months ago how niacin kills superbugs. So niacin is, and I'm not talking about virus, we're talking about bacteria, but niacin, and it's important to understand it's the flushing kind. I'm not really that big a fan of non-flushing niacin or niacinamide. I think you need the flushing stuff, and what happens is it'll make you flush immediately when you first start using it, then your body kind of gets used to it. You'll have less and less flushing. But I know that there's a huge niacin flush that can occur. On 2006, my dad and I were working in a basement here in Pocatello office, and it was on a cement slab, and we were there only a couple months. I think we were 8 or 10 months. And what happens is in the wintertime, that cement would get so cold. And I asked my dad one time, how can I warm up? Like, I'm freezing. And he said, hey, go take some niacin. Now, I can remember the dosage. He said, take 100 milligrams of niacin. I went and I thought, in my office, well, if a little is good, a lot is better. And so what I did is I went and took 200 milligrams, and about 5 minutes later, I had to take my shoes off, my socks off. I went outside and I walked in the snow. I know what a hot flash feels like. Not that I've had any hormone flashes, but that niacin episode, wow. So if there's concerns with CBD without THC and liver, I would immediately go to niacin, 100 milligrams, or some milk thistle, or some stinging nettle. I really like, there's a lot of things that you can do for liver health. Okay, Nancy and Wade Saunders. Hey, you guys, we have daughters with digestive issues. Well, about 80 to 90% of people that come in the office have some type of stomach problem, so I'm excited to talk about this. What would you do to help with leaky gut? That's one. What would you do? Celiac and hormone issues. What would you do to help? Wow, there's a lot of questions in here. So let me just back up and say this. Okay, so how to start working with stomach problems. And a shout out to my friend Ryan Harris. He posted a question on Facebook and earlier this week. What do you do for health? And basically I'm just going to tell you exactly what I posted on his page. And that's this. You are what you eat, and you are what you absorb, and this is how I kind of put the whole stomach system together. So you start digesting in your mouth. You want to make sure that we have good mucus health and stuff like that. Again, that's vitamin A, and that's making sure that there aren't any issues with the parotid glands, which are the little glands sit right here, secrete saliva. There's a way that we do an assessment for that in the office. The next thing is you want to make sure that you have an acid stomach, but also a bunch of stuff to support the acid. So it's kind of a double-edged sword. You get too much acidity, it's going to bother your stomach lining. If you don't have enough acidity, what's going to happen is you can't break down food. It sits there, it ferments, it rots, and decays. So you want a healthy mucilaginous layer where it can hold that industrial hydrochloric acid, which is going to digest food. And one of my favorite things to do with people that have stomach problems is to just go through a simple protocol. First of all, have you used a digestive enzyme or something to help break down food? That's number one. The second thing is to make sure that we have enough fat-soluble vitamins A, D, E, F, and K. And people say, well, I haven't heard about vitamin F. We call that bioflavonoids. But those vitamins are your fat-soluble vitamins. They help to heal and soothe irritated GI tissue. Then I always say, have you tried a probiotic? Because the probiotics take up landing spots for bad bacteria. And then what happens is it helps your stomach to get healthy. And then you start talking about the pancreatic enzymes, the liver gallbladder system, making sure you have enough bile, and that you're having good absorption through the last part of the GI system, which is the colon. So first thing we want to talk about is making sure we're getting the fat-soluble vitamins, either in a supplement form or making sure that you're getting it from raw fruits and vegetables, a digestive enzyme, and then also some probiotics. Then we want to make sure that the pancreas is working well. There's some specific blood tests and stuff that you can do for that. Excuse me. Got a frog in my throat. The next thing is making sure that we have bile, and I think bile is underrated for helping stomach problems, because as fat comes down into the GI system, if it's not broken down and emulsified, what happens is the food sits there, it ferments, rots, and decays, the bowels slow down, and it doesn't work very well. So that being said, that's how we start working with stomach process. Now, one of my favorite things to do, people, and I think I can bring it up right here on your system, is, let's see here. Oh, I had it, now it's gone. But there's a product that I call GI Revive, which literally helps to seal off the little permeable, the little cracks inside your GI system associated with malabsorption syndrome and leaky gut and stuff like that. It has a digestive formula associated with it. It helps to heal and soothe irritated GI tissue. And then you want to make sure that we're breaking down the food, digest. If there are other GI problems at the latter part of the colon, there's a herb called okra that I really like that acts to literally vacuum off the walls of the GI system. It's like running a lint roller, just pulls all the junk out of that doesn't give you GI distress and other things, and then also making sure that you're giving fat-soluble chlorophyll that helps with any bleeding that's occurring. So the question about the leaky gut, the celiac, the hormone issues, man, this is something that I could lecture on for a long time. The other question about hormone issues. What would you do to help? Well, the problem with hormones is you have to get the hormones balanced. You have to know what the ratios are of progesterone, estrogen, the progesterone, estrogen ratio, cortisol for the inflammation, testosterone both for males and females, and also DHA, which is basically a hormone precursor. It turns into so many different hormones and stuff in the body. There's a really neat saliva panel that you can do for that and help. So we just need a little bit more information about that. And then the other thing is to make sure that you're not eating things that are hard to digest, which is particularly things, sometimes nuts and seeds and stuff really irritate certain stomach conditions. But anyway, I can answer this question with a little bit more information, but that's a nice overview. Okay, the next questions that we've got asked is, Dr. West, what do you do for headaches? Wow, okay, another huge question and topic. One of the things, I even wrote a book about it in the chapters in my book. I think I want to say chapter 21. Not only we talk about stomach problems, we talk about headaches. There's over 100 different types of headaches. And so we have to just be aware of the classification. Is it a hormone headache? Is it a migraine? Is it a cluster headache? Is it a cervicogenic headache? Is it a sinus headache? Is it a stress headache? I mean, there's a lot of different things, but trying to put everything together for for headaches is, let's just start with the things that I think respond the best. So how I would take care of a headache, do a comprehensive history and trying to figure out, is there a trigger? Is it stress? Is it food? Is it hormones? And I want to pick on hormones just for a second, because one of the neatest things how to help chronic migraine headaches, particularly related to female menstrual cycles, is to recognize that there's an office manager in the body called the pituitary. Now, the pituitary sits inside a little bony cup called the sella turcica. It's it tells everything what to do. It tells the thyroid what to do. It has influence on the hypothalamus and the adrenal glands and the liver and all of that. And what happens is when it gets overworked at cycle time, particularly mid-cycle or when a hormone cycle starts, that pituitary is just like a muscle. If you overwork it, it tries to basically expand and there's no place for it to go and you get headaches. So there's a really neat proteomorphogen therapy or basically glandular therapy called pituitrophin or pituitary extract. If you give that to women, I've seen a lot of headaches improve. It's kind of a secret sauce. Another thing that's really helpful is a manipulative therapy, chiropractic, osteopathic adjustments, getting rid of the stress up in the upper trapezius and the neck with massage therapy is really good. And we are going to, next live cast, I'm going to show a video of doing some cranial adjusting. It's something that my grandpa taught my dad and my dad taught me. Dr. Nelson's aware of it in the office. We actually have a video of him doing some cranial adjusting. And it's so helpful to basically get those sutures to reset. So the sutures are where your bones come together. You have these little zipper bridges. And what happens is they can get jammed and they don't move. And in medicine, the thought process is that once you get to a certain age, the cranium fuses and doesn't move. I don't think that happens. I think there's some micromillimeter movement. And what happens is those get jammed up. If you free those with some cranial work, you've seen a lot of adjusting go, a lot of adjustments help, cranial work. And then there's a treatment where we can get your nerves to reset called the crown of thorns treatment, or it's a neural therapy treatment. You do these little tiny injections around the widest circumference of the head. This is something that we're going to talk about next Thursday night at 7 o'clock. We're going to do another live cast, and that's something I'm going to put on the agenda is headache things. So we've talked about vitamin A, we've talked about stomach problems, we've talked about water, we've talked about some coronavirus testing, and hopefully they're going to come out with an antibody test. We briefly dived into stomach problems and recognizing there's a whole bunch of different segments of the stomach, and depending on where the problem is, depending on where the solution is. And then we're also talking about what we're doing to be healthy during the coronavirus pandemic, which is healthy and alive foods, eating foods that spoil, hopefully eating them before they spoil, water, rest, vitamin A, vitamin C, vitamin D, and zinc. We also showed a little parasite video of what causes an enormous amount of health problems that is not evaluated that very well in Western medicine testing, in my opinion. So that being said here, we have another question here. Bobby L. says, is beta-carotene or vitamin A better? And my response to that is, good question. That's like saying, which is more important for a bird to fly, the right wing or the left wing? Now, I know that's kind of a smart aleck response, but you got to have both of them. So beta-carotene is different than vitamin A. Beta-carotene basically comes out of colorful squash and peppers and carrots and stuff like that. There's usually vitamin A almost always associated with food that has beta-carotene, but it's one of those things that you need to be overall healthy. And so it's not an either or thing. It's basically a right wing and a left wing. And I wanted to show you, I've got a great study that I wanted to share with you guys. And so let's get this pulled up. I can pull it up here right on my, right on my screen here. So this is one of my friends I met at a conference, Sayer, and he put together an amazing website called Green Med Info. This is one of my favorite websites to go get information. And the reason why this is a good place to talk about Bobby L's question is because inside of the study it says the review of micronutrients in the immune system working in harmony to reduce the rate of infection. So it was in Nutrients Magazine, January 2020, and basically it says immune system support of micronutrients is associated with a vitamin C deficiency. And we talk about vitamins A, D, C, E, B6, B12, folic acid, zinc, iron, cadmium, selenium, which play vital synergistic roles in this process. And so what does that mean? It means you can't just take one. So Bobby, it's kind of like your question, which is better, beta-carotene or A? And the answer is all of them. Now, the best source of nutrients is your knife and fork. It's what you're eating and putting inside your system. I use supplements as I didn't have the study up. I use supplements as food insurance. So what does that mean? That means that you're wanting to make sure you're not missing anything. You supplement what you're eating. And then I love this statement at the end of the study. Micronutrients with the strongest evidence for immune system support are vitamin C, vitamin D, and zinc. Now it says better design of chemical studies addressing dosage and combinations are needed. But what's happening is the benefits of micronutrient supplementation against infection. This is a really good study to start. And the answer is we need all of it. Now, Kathy McDevitt. Hi, Kathy. What she wants to know is, okay, I'm worried about boosting the immune system because people say I have high histamine. Now, histamine is basically one of the ways that your body responds to an infection, it responds to inflammation. And if you supplement and you're using the right things to help your immune system, it isn't going to kick your histamine levels off the charts, in my opinion and my experience, particularly getting vitamin C. I haven't seen vitamin C kick off high histamines, and maybe I'm missing something in your case, but I would totally be working on your immune system, again, with a good vitamin immune system program. Vitamin A, vitamin Z, zinc, echinacea, I think is really effective for this. Now, how I would manage the histamine is by cleaning out the thyroid. The thyroid is a secondary gland of detoxification, so liver and kidneys are primary, adrenal glands and thyroid glands are secondary, and there is a wonderful Japanese herb called yakatron that helps to get rid of a buildup of toxins in the thyroid associated with histamine production. I've used it for 20 years. It's a secret, again, that comes out of being in a family clinic system that's been around for 105 years. But yakatron is so good for histamine regulation. And there's another one, histamine in a homeopathic consideration. I've seen reasonable outcomes with. It doesn't help everybody. It's been an absolute life changer for other people. But there's a way that you can regulate histamine levels by working on the natural health of the thyroid. And you should be working on your immune system. It's not going to be triggering your histamine, in my opinion or my experience. Okay, now we're going to wrap up soon. I want to take a couple more questions, and let's talk about, again, the importance of gut health. You are what you eat. You are what you absorb. We had a couple questions about that. Here are a couple considerations for gut health. Digestive enzymes, probiotics. One of my favorite amino acids that help cells to repair is something called glutamine. I'm looking also over here at some of what I've got that I brought outside of the office that I routinely give to people to help with gut health. Glutamine, GI Revive. I like liposomal vitamin C primarily for the immune system, but it really helps to seal pits inside the system. And then just a clinical pearl, one of my dad's formulas that I've seen that are really good for people that have ulcers. How you can help people that have ulcers is your fat-soluble vitamins, A, D, E, F, and K help to heal and soothe irritated GI tissue. So that's step one. Speeding up digestion, the other thing. And then there's a really neat medicine that comes from Switzerland called anacardium. And I've seen anacardium really help people that have H. pylori in their system. Now, just a reminder, I'm giving away some liposomal vitamin C, in my supplement giveaway. There was 2 requirements to win the liposomal vitamin C. Number 1, post a question. And number 2, to give your best estimate of how many copies that photocopies that my dad gave out over his 50-year career to patients. It's just a fun little stat. It's total random and erratic. It's like just how many dollars are in the jar, how many marbles are in the jar, something like that. But it's a significant number. It's way high. Someone said 10,000. It's way higher than that. It's way higher than 100,000. It's higher than 250,000 copies. So I'm just curious to see if someone can get close to it. Okay, Norma Marino. Hi, Norma. We've done some email correspondence back and forth. Do you recommend doing a detox before an evaluation with you? And one of my responses is maybe and maybe not. Now, I think detox programs are healthy for people to do primarily with water and cleaning up inflammatory foods in your system. I've seen some complications arise doing the gallbladder flush detox and having people do too many saunas and colon therapies and stuff like that. And so the answer is this. I really think it's good to eat and be and live as healthy as possible before coming to see. It's really helpful to have some blood tests that are not longer than 90 days old, a complete blood cell count with auto-differentiation, a complete metabolic panel, a fasting cholesterol test, not always because cholesterol is too high. I think cholesterol is one of the underrated things in health. When it's too low, you get below about 150, you don't do so well. If you get below 120, it's difficult for your body to make hormones. And if you get below 100, bad things happen and your risk factor for certain diseases go up. Cholesterol is really an important part of the body. Too much is bad, just like sugar. You get too much sugar, you get diabetes. Too little is bad, and you get lapse into coma and you die. So you want to have health in both ends of the spectrum. And so, Norman, answer to your question is I think it would be really good to eat clean. I think it's a good idea to do some intermittent fasting. I'm a big fan of that. I have a really big hero in healthcare, Jason Fung out of Toronto. Dan Pompa's another really good one for detox, and he's a personal friend of mine. And I think that those are really good things to do. And then the next question is, if so, what type of detox and how long for an appointment? Well, one of the things is, if you could get healthy without coming to see me, like, you should totally do that. And you should try a detox program, because what the goal is inside the office is to get you to achieve and maintain optimal health. And I'm the coach on the sideline, you're the all-star player. If we're communicating, we can get you healthy. And so I would love for you to basically eat as clean as possible for a couple weeks before seeing me, get your blood test put together. I like different types of detox programs, and I like the intermittent fasting is my favorite. Heat deprivation therapy, which is almost in all societies, whether it's bathhouses and spas and saunas and infrared saunas and salt pulling and oil pulling. I think all of those are good. Now, cupcake paper. Hey, cupcake again. What causes esophagus spasms? And let me see. I just got to click this over here just a little. What causes esophagus constrictions? I had a dilation about 6 months ago. Well, I hope that the dilation went good for you and that you improved that basically stricture at the bottom of the esophagus. I hope it went well for you. Now what we want to do is to make sure that that stricture doesn't come back. And so a couple things that are considerations. I think minerals and a really good mineral balance would be good for you, and that is a calcium to magnesium, calcium to phosphorus, calcium to potassium ratio. I think that's really important. I think protecting the bottom part of the GI system, the bottom part of the esophagus and the GI system with your fat-soluble vitamins, your A, D, E, F, and K help to heal and soothe irritated GI tissue. You don't want any of that tissue to get up inside of that esophageal ring and causing that spasm or close off. And then also to make sure that you're chewing your food. I think that there's several different recommendations of how many times that you should chew food. I heard one time 30 chews for each bite of food that's in your system. I think that's really helpful. And again, vitamin A helps to lubricate the mucous membranes. Also a consideration for digestive enzymes. And then one of my favorite things, and I need to add this to the live cast next week, is something called neural therapy. Now, neural therapy is one of the missing gems that more and more doctors are doing. It's really a lot more common in Europe, and it's not less as common here in the United States. What neural therapy is it's a way to help with nerve memory. So let me explain what that means. When you have chronic health problems, it's not uncommon for your nervous system to be triggered or irritated, and then what happens is it fires. It basically is like phantom limb syndrome. So I'll have a rancher or a roper that comes in the office. They'll be out working with their animals. They'll get a rope caught around the finger. The cow takes off, pulls their finger off, and they'll come in the office and say, "Dr. West, my finger's killing me." Even though it's not attached to the body, there was basically a stretching injury that occurred to the nerve, and the nerve basically is telling the brain, "I hurt, I hurt, I hurt, I hurt." Now, in a case of esophageal constrictions or spasms, what's happening is the nervous system tells the brain all the time, "I hurt, I hurt, I hurt, I hurt." If your body was a computer and you called tech support would say, "Turn everything off and turn it back on, reboot the system." And my joke inside the office is we can't really kill you and bring you back to life, so that's not a consideration. But neural therapy, you take a modified B vitamin, it's a glycolized ester of para-amino benzoic acid. You go to the different stomach control points and acupuncture points around the stomach and the esophagus. You do this little mosquito bite therapy and literally makes the nerves hyperpolarize, depolarize, and repolarize. What that means is it helps to get rid of the nerve memory that's telling the brain, "I hurt, I hurt, I hurt," or the constriction, the phantom limb syndrome, the chronic pain, the complex regional pain, reflex sympathetic dystrophy, organ dysfunction. There's a way that it's a consideration. Now, does it help everybody? It doesn't help everybody. Does it help a lot of people? It helps a lot of people. It's not just me saying it. You can see a lot of the instances where we've been able to help people on our blog, dailydosevitaminh.com. And so that's how I would go after esophageal spasms. Now, I need to see if people have any numbers. Anybody close to the number of my dad giving the handouts? Because we're going to wrap up in a minute. We want to do the giveaways. And so I'm putting together an ultimate digestion supplement pack. I'm so excited to help people with GI problems because everybody that has a chronic health problem is either not digesting their food or not absorbing their food. It's such a huge problem. It was really funny. There was a Surgeon General that said that 80% of the healthcare problems in the United States come from stomach problems. And someone asked her kind of a silly repeat question, and she said it's not 8 out of 80%, it's 8 out of 10. And so obviously that's just kind of a funny thing that we're saying. But the thing that's happening with people that have health problems is it's stomach related. So I'm putting together a GI pack. If you're interested, do hashtag GI inside the comments. I want to get you some information of how we can rehabilitate the GI system, both the esophageal component, the stomach component, the liver gallbladder axis. If you don't have a gallbladder, that means we need to help with your liver so that it's secreting bile when fats go through it, so that you have a good constipation relief or diarrhea relief, that the bile works both ways. And then the bottom part of the GI system is all really important to take care of. So we have a program that helps with all of it. If you're interested, hashtag GI. Now, there is a couple different questions about this. So we have a winner. Nancy, you are the winner. She said, I said, how many questions, or excuse me, how many photocopies, handouts did my dad give in his 51 career? It was actually close to 4 million. Nancy was closest, 2.2 million. The reason why we came up with 4 million, we had two copiers that had a little count on them, and he would put the copies in there. He'd write these book reports. He'd hit the copy button, and what happened is we went through 2 copiers of 2 million each. It was actually more than that because he would print stuff off on his printer, but it was around 4 million. So Nancy, I'm going to send you some liposomal vitamin C. I'm so excited for you to participate. Thanks to Bob, to Cupcake, to Julie, everybody, Rebecca, my friends in California and also Michigan. I'm really hoping that you're staying safe, you're staying healthy. Remember, your immune system is the key. This virus is really transmissible. It only makes sense that all of us are going to eventually be exposed to it. If not as significant, people have already been exposed to it. And what the key is to keep your mucous membranes healthy. Now I'm excited to share with everybody our customized GI pack. We have about 10 of them. It's hard to get products from vendors right now. It has the GI Revive in it. It has a way to heal and soothe your tissue. It has a pancreatic enzyme in it. There's a way to help break down the food right and manage the bile. And also just wanted to tell people, if you want more information about this, you can go to drwest.info and you can get my book. I have a chapter written about stomach. I have a sleep chapter. I have a what supplements to take, what treatments that are most important, I think, in chronic healthcare conditions. It's an Amazon bestseller. You can get it on Amazon and you get the office. drwest.info is where you can get it. So we are turning this into a tradition of helping people to understand their healthcare options, because when people know their options, they make good clinical decisions. And one of my biggest frustrations in the office is when people say, I just wish I would have found these treatments or treatments like you or a doctor like you sooner. And so we really want to give a platform and to help people. That's why we're doing the question and answer period. Nancy, you're the winner. Thanks everybody so much for participating. Again, if you want more information, don't worry about writing everything down, because I can get it for you in the book.